is Dr. Bob Brown from Mayo Clinic Rochester, and he is a professor of neurology, former chair of the Department of Neurology at Mayo Clinic in Rochester, and he's going to speak to us today on the management of unruptured intracranial aneurysms. So please welcome Dr. Brown.
Well, good morning, everybody. Delighted to be here with you today, and again, welcome, and thank you for coming to this course. I look forward to sharing with you over the next 30 minutes or so some of the more commonly asked questions that I receive regarding patients who have unruptured intracranial aneurysms. And just from a show of hands, how many of you in this room have seen a patient within the last 6 months who had an unruptured aneurysm that was fortuitously detected on an imaging study performed for other unrelated reasons? So virtually everyone, and this is such a common scenario that is now seen in clinical practice because, of course, we're doing CT scans and MRI scans for so many reasons. We're finding these unruptured lesions, and the question is how best to manage them. And so I'm going to take you through some of the common questions that I receive. I don't have any financial interests or disclosures. So just as we get started, the two cases that I'm going to share with you likely mimic cases that you see in your clinical practices. And here's an example of a woman who had an imaging study performed for chronic headaches. She had a prior history of subarachnoid hemorrhage and aneurysm repair many years ago, but now presented with headaches. And this small anterior circulation aneurysm, 2 by 5 millimeter aneurysm, was detected on imaging. Subsequently, additional scans were performed as noted on this image, but this is a great example of a fortuitously detected aneurysm unrelated to her headaches. A 72-year-old woman who had transient visual disturbances that were thought to be migrainous in nature. She had a history of hypertension, cigarette smoking, negative neurologic exam. And here's an example here again of an imaging study that showed an unexpected aneurysm that was detected on imaging. And so for both of these patients with fortuitously detected aneurysms, the question is, how should these best be managed? So some of the questions I'm going to take us through now include the medical disorders that are associated with intracranial aneurysms. Who should be screened in the setting of these entities? And also, if there's a family history, who should be screened within the family members? Once an unruptured aneurysm is detected, what is the natural history in terms of the rupture risk over the course of time? And is interventional management indicated for that aneurysm